Hi, I'm Ron Villano, licensed psychotherapist and author of The Zing. And today we'll be speaking to two physicians from Queens Pediatrics, located here in Howard Beach, on how to take the fear out of your child going to a pediatrician. And we're going to learn some tips and tools from Dr. Petinos and Dr. Shim, and we'll see how we can help you to make your child's visit a little bit easier next time and eliminate some of that fear. Today we're speaking with Dr. Thomas Shim from Queens Pediatrics. Dr. Shim has been practicing pediatrics for 15 years, and the question we have today is, how do parents get their child to get over the fear of coming to a pediatrician? And you as a pediatrician, how do you help them? You know, the kid comes in, he's nervous, mom's probably more nervous. How do you handle this?
Well, that's a complicated question because every kid's different, but in general, I think kids do best if they're familiar with the surroundings. And at first that might be a little bit of a contradiction, because what most parents know is that when kids grow up in a pediatrician, they learn from infancy that it's a place where they can get shots, and they get very, very nervous. And growing up, they attain that knowledge and familiarity with the place as something that's good, but in some places not so great.
No, you like it.
What age of a child is the most difficult to work with? What ages?
You know, it's a good question, and I wish I had an easy answer, but infants are easy because they really don't have any fear. You know, they have no idea. So what they do is they basically come in, we do the visit, and they leave. Once they get older into toddlerhood, they get a lot more difficult. You know, they can fight you. You can't reason with them. So I guess that would probably be the edge, or the most challenging, like, I guess, phase. But then afterwards, you know, they may still be upset, but they're able to be reasoned with. They can, you know, be talked to, and a lot of times it works, believe it or not. You can say, this is what you need this for, and a lot of times they'll accept it.
When I speak to the parents as a therapist, psychotherapist, how if you listen to your child and you listen to what they're saying, a lot of times you'll omit a lot of issues that parents have with kids. Right. So you're saying something similar. So what's the scenario? Like, what would
scenario is a child comes in, they're sitting on the exam table, and I want to examine them, and like, hi, how are you? They give me a look. Let me look in your ears. I'm looking for Mickey Mouse in there. And then I find one of their favorite characters, and they light up a bit. And who's in the other ear? And we look in the other ear, and before you know it, the most difficult part of the exam is done. Maybe lying down, they still have a little bit of an issue.
And it depends on the kid, because sometimes you do that to one kid and they love it, and you do it to another kid and like, what the heck are you talking about? This is not right. So you really have to feel, you know, your way around, because some things work for some kids and some kids don't.
So what's some tips you would give a parent watching right now who's saying, you know, I have my little baby now, is, you know, 9 months old, and I got to go back to the doctor, you know, I feel more pain bringing my child there, and I don't want my child to be scared. You know, and they think it's a lasting fear. In other words, when they bring the child here, I have patients who come to me and they'll say, you know, when my child sees you, sometimes they're relating you to the pediatrician, like they're going to get a shot.
Right.
But is that when it all starts, like the child feels, okay, when I come to this place, I'm going to come to a place that I'm a little fearful of, and how do we get them over that?
Some of them will take a little while to get over it. But we give them a lollipop at the end of the visit, and they most of the time forget what just happened.
Well, with very few exceptions, you should always be truthful with the child. The worst thing you can do is say everything's going to be okay, everything's going to be honky-dory, and the kid finds out he's going to get 5 shots. That's the worst, because he'll never trust you again, or at least for a very long time. You know, there's some kids where you really do have to hide the fact, because they will just lose it from the moment you tell them what the truth is. So it really is up to the parent to figure out what their child is, which is pretty much what they have to do every day. So it doesn't, this is not an exception. But given an overall sense, you should not be deceitful to your child. You know, you may not tell the entire truth, but you shouldn't be outright contradicting what's going to happen.
Now that you've learned some wonderful tips and some tools on bringing your child to the pediatrician and eliminating some of those fears that your child was having, it's going to be a lot easier for you and a lot nicer visit for your child. I think some of the tools we've learned from Dr. Shim and Dr. Petinos will go a long way for you and your family.